Doctors are meant to save lives. But what happens when they turn into killers? Today, we're diving into the terrifying story of Dr. Harold Shipman, the man responsible for the deaths of more than 500 people. A trusted physician, Shipman used his position to carry out one of the most horrifying killing sprees in history. Harold Shipman was born in 1946 in Nottingham, England. He trained as a doctor and, by all outward appearances, was a caring and competent physician. But beneath the surface, something far darker was brewing. Shipman's early career was marked by one major red flag. In 1975, he was caught forging prescriptions for himself, an early indicator of his addiction to painkillers. Though he was fined and briefly attended rehabilitation, no one could have guessed what he would later become. After a brief suspension, Shipman returned to practice and settled in Hyde, a small town where he became a beloved family doctor. Patients trusted him with their lives, and that trust is exactly what he used to kill. Shipman's killing spree began in the 1970s. His method was simple but effective. He would inject his patients with lethal doses of morphine, a powerful painkiller similar to heroin. Most of his victims were elderly women, many of whom trusted him implicitly. As the years passed, Shipman's death toll quietly grew. His patients would die suddenly, but their deaths were often attributed to natural causes. To their families, Shipman was simply the caring doctor who had been there at the end of their loved ones' lives. Shipman wasn't just content with killing his patients. In some cases, he went so far as to forge wills, making himself the beneficiary of his victims' estates. His greed and cruelty knew no bounds. Shipman's reign of terror might have continued indefinitely, but in 1998, a local undertaker began to notice a pattern. Many of Shipman's patients were dying in similar ways and under suspicious circumstances. The alarm was finally raised. The police began investigating, but Shipman was careful. He destroyed medical records, forged documents, and covered his tracks well. However, one brave woman, the daughter of one of his victims, pushed the investigation forward, refusing to believe that her mother had died of natural causes. In September 1998, Harold Shipman was arrested, but it was only after an exhumation of several of his patients' bodies that the full horror was revealed. Shipman had murdered hundreds of people over 2 decades, making him one of the most prolific serial killers in history. Shipman's trial began in 1999, and the evidence against him was overwhelming. The court heard testimony from devastated families, medical experts, and detectives who had uncovered his heinous crimes. In January 2000, he was found guilty of 15 murders, but authorities believed the true number of victims exceeded 500. One of the biggest questions in the Shipman case is how he managed to kill so many without raising alarms. Part of the answer lies in his method. Shipman carefully targeted elderly patients whose deaths were often attributed to natural causes. His reputation as a trusted doctor helped mask the true nature of his crimes. Shipman didn't fit the mold of a typical serial killer. He was calm, professional, and well-liked by many of his colleagues. He maintained a facade of normalcy, but underneath it all, he was manipulative and driven by a thirst for control over life and death. Morphine, or medical-grade heroin, was Shipman's weapon of choice. He exploited his access to controlled substances, and his background as a physician allowed him to mask overdoses as legitimate medical treatments. His addiction to drugs played a central role in his descent into murder. Shipman primarily targeted elderly women, many of whom lived alone. These women trusted Shipman as their family doctor, and he knew that their deaths would likely be overlooked as natural causes. His position allowed him to prey on the most vulnerable members of society. After suspicions arose, forensic experts played a crucial role in confirming Shipman's crimes. By examining the bodies of his victims, they discovered lethal levels of morphine in many of them. Without these forensic breakthroughs, Shipman might never have been caught. When the news broke about Shipman's murders, the public was shocked. How could a trusted doctor, someone people turned to for help, have killed so many? The case left a lasting scar on the national psyche, especially among those who had trusted medical professionals implicitly. Shipman's case led to significant legal changes in the UK. Medical authorities reviewed how doctors are monitored, leading to stricter guidelines and oversight. One of the most notable outcomes was the introduction of reforms in the death certification process to ensure no doctor could manipulate records again. The Shipman Inquiry, led by Dame Janet Smith, was a public investigation into how Shipman was able to kill for so long. The inquiry lasted several years and led to numerous recommendations that have since reshaped the way doctors are monitored in the UK. The families of Shipman's victims were left with more than just grief. They were also left with unanswered questions. Many had trusted Shipman with their loved ones' lives, and the revelation that he had killed them devastated entire communities. Shipman's actions baffled even seasoned psychologists. How could a doctor, sworn to do no harm, turn into such a cold and calculating killer? Experts believe that his actions stemmed from a combination of a need for control, a superiority complex, and perhaps an unacknowledged addiction to the power of life and death. Shipman was sentenced to life in prison without the possibility of parole. However, just 4 years into his sentence, Shipman was found dead in his prison cell, having hanged himself. Even in death, Shipman took control, leaving the families of his victims without closure. After Shipman's death, the UK government launched a public inquiry into his actions. The inquiry found that Shipman had likely killed over 500 patients, mostly elderly women, and that more could have been done to stop him earlier. Shipman's case sent shockwaves through the medical world, leading to significant changes in the way doctors are monitored in the UK. It exposed the vulnerabilities in the healthcare system, where one man was able to manipulate and murder so many without being caught for decades. The story of Harold Shipman is a chilling reminder that even those we trust the most can hide the darkest secrets. It's a story of greed, manipulation, and mass murder on an unimaginable scale. Be sure to subscribe for more true crime stories, and let us know in the comments what cases you want to hear about next.